Hi everybody, and welcome to this special edition of the Mama Soul Expert Series. I'm so happy you're here. And if you're new to our community, welcome. And if you've been with us for a while, you know that at Mama Soul, we're all about creating little moments of self-care in the middle of real life, especially in motherhood. So I actually started Mama Soul when I was 5 months pregnant, and I couldn't find a mineral sunscreen that I truly loved, something that felt good on my skin, was safe for pregnancy, and that made me feel more grounded during a time when everything felt like it was changing. So I wanted something, gentle and clean, but that also looked beautiful that I could keep on my vanity as a reminder to use it every day. So I have over 15 years of beauty industry experience. So when I couldn't find what I was looking for, I created it myself. So our formulas are 100% mineral, safe for everyone, including pregnant and nursing moms. And they're made with a subtle hint of lavender essential oil to help you pause and take a deep breath with each use. It's really just a small daily ritual that reminds you to take care of yourself too. So that same intention is what inspired our expert series. So we wanted to go beyond skincare and create a space for, real meaningful conversations that support your full well-being. So each month we bring in experts whose work revolves around wellness, parenting, spiritual healing, manifestation, and mental and physical and emotional health. We believe that, caring for yourself is the heart of everything we do. So today's guests are two incredible Stanford PhDs, Dr. Elizabeth Reichert, who is a clinical child psychologist, and Dr. Mari Kurahashi, who is a pediatric psychiatrist, who both specialize in parenting. And they're here to talk about the hard and sometimes beautiful work of raising emotionally healthy kids. So, from meltdowns and ADHD to sibling conflict and how to discipline with care, we're covering it all. We received an outpouring of thoughtful, vulnerable, and very insightful questions from our community. And honestly, it was way more than we could ever cover in one session. But we noticed the recurring themes about emotional regulation, sibling conflict, neurodiversity, setting boundaries, and navigating really big life moments. So we've structured today's conversation around those themes to offer you the most value we can. So before we dive in, I'm going to ask everyone that's on the call to please take out your phone and follow two accounts on Instagram so that you can be entered into the giveaway that we are offering at the end of the call. So the two accounts are, if you're not following Shop Mama Soul, it's Shop MAMASOL, and I'll put this all in an email afterwards as well. And then also Stanford Parenting Center. So it's Stanford _parenting_center. And the winner will receive any item from Mama Soul and a 30-minute consultation with Dr. Reichert. So everyone will also receive a 15% discount using, and I'll put this all in an email, but everyone is also going to get a 15% discount using the code expert series at checkout for any of the live or on-demand classes at Stanford Parenting Center. So the Stanford Parenting Center provides services to parents that are repetitive, early intervention, and evidence-based treatments. And for those who don't win the giveaway, Mama Soul is also offering a 15% discount to everything on the site with the code Stanford15. Okay, so everybody take a deep breath. Let's settle in and get started. Okay, so Dr. Reichert and Dr. Mary, I want to ask you both, and I'll start with Dr. Reichert. What inspired you both to specialize in children and parenting, and what makes your approach unique?
That's a great question. I think, over time throughout my career, I had initially, I had always worked with children with anxiety disorders and disruptive behaviors, and I know Mari and I have talked about this a lot over the years. Over the years of doing that work, we really saw that while we could be really effective in the one-on-one treatment models that we have. It was also we were we saw opportunities to be more effective and being able to reach more people by being able to work more directly with parents. And so we had started to, myself, I started to kind of integrate parents a lot more into the work that I was doing because, especially with younger children, I mean, there's parents are so integral in a child's day-to-day functioning. And what I might be doing with a child in a one-on-one session is not necessarily always going to translate to home. And by integrating in parents into the work, we've been able to find that we were way more effective. And then I think kind of with that, then simultaneously the research was also catching up to the work that we were doing in our offices and realizing that actually working directly with parents can be just as effective, if not more, than working individually with a child. And so I think over the course of the years of being in this field of realizing, wow, I can be so impactful, yes, with the kids that come into my office, but also working with their parents and families had really inspired Mari and I to continue to build upon the work that we were already doing and create the parenting center.
So cool. Well, we are
Yeah.
so excited that you did because I think it's really hard as parents to find the resources to help us navigate all of the different ages and the different, you know, challenges that we face every day as with our growing kids. So thank you so much for doing what you do. Dr. Kurahashi, can you answer the same question? I'll repeat it.
Ready?
Yeah, what inspired you to specialize in children and parenting and what makes your approach unique?
Yeah, I definitely agree with everything Dr. Reichert said. And I think if you think about it very practically, when we work with children individually in our office, we see them maybe an hour a week versus the child lives in the home, the family with parents the rest of the time outside of school. So the time that the parent spends with the child is just so much more relationship. It's, the parent-child relationship is unlike any other. So by supporting parents, we've just seen over and over again how much more impactful that can be, and more quickly as well if we're able to shift the home environment. So I find it really meaningful to do the work that we're doing. And we're also mothers ourselves. And so I think we've also been on this parenting journey and we think a lot about parenting, maybe too much sometimes, and see the benefits we have given our profession and our areas of specialty and how we definitely are humbled every day by our own children, by our own parenting, and we feel very appreciative, though, of the knowledge that we have and the clinical experiences that we have, and so wanting to also share that on a wider scale as well.
It's amazing. So we're going to talk about, we had, like I said, we had so many questions come in. So we really did tailor this whole series, or episode today to everybody's questions. So the first one it's the whole topic of discipline, limits, and gentle parenting. So number one is let's just start with the big one, which is discipline. So many parents asked about how to set limits while still staying connected. So your practice focuses on early intervention and evidence-based treatments. So what does that look like in real life for parents? Like, what does that mean for us?
Yeah, so I think and there's lots of different things to say on this topic, of course. And I think so many parents will ask this question, and they're I think the first thought is around the discipline piece of things, right? Like, how do I set that limit? How do I discipline my child when they're doing something inappropriate? And I guess the way I always like to think about it first is, while discipline is important and there are ways that we can do that in a really healthy and supportive way for our child, it's also equally as important to make sure that we are building in time for connectedness, and we are also teaching our child the way that we want them to do the thing instead, right? So if you're struggling with your child hitting or yelling or using inappropriate language, if we're just focusing on the discipline piece, to address that behavior, we're kind of missing this whole other opportunity to actually help teach and support our child how to do the opposite of that behavior, right? How to manage the big feeling that they're having without yelling, right? Or how to express what it is that they want to express with more appropriate, kind, gentle language. How to do those things. And so there's a lot to be said about connectedness, which I think we'll get into, and talking about special time and ways to connect with your child. But I think also catching your child engaging in the behaviors that you want to see more of, and making sure that you're praising those behaviors,
Yeah.
that you're letting your child know that you see those behaviors. Because so often we end up just focusing on all the negative
Yeah.
behaviors and focusing on the discipline. And yes, there is for sure a time and place for that. But if we're not focusing on the things our child is doing well and helping to teach them how to do those things well, then we're missing a real opportunity for the behavior to get better.
Yeah, I'm always catching myself to make sure that I am praising my child when he does something, when one of them does something good, because so often I find myself not only, not want to say shaming, but for doing something bad, but I do a lot of bribing, and that's something I want to talk about too. I'm sure a lot of us do that, and I do it probably too much. So I guess the question is here, what are some realistic strategies? If you could give us, two, that without yelling, without shaming, without bribing, what is something that we can do as parents?
To piggyback on what Dr. Asher is saying, if you think about kind of the go-to negative characterization you might have about your child, whether it's, oh, he's so aggressive, or he's so overly sensitive, or so whiny, or so willful, or never listens, or whatever it is, like probably for each of your children, when you're stressed and frustrated, there's probably some narrative you have about your child that's negative, that's like kind of that really pushes your button. And so if you think about whatever that is for your child, and then you think about, well, is my child ever the very opposite of that? And it's like when you think of that, initially there's like this tightening and this, and then when you think about when they're the opposite, there's this kind of relaxing and openness that comes in. And so one strategy that Dr. Asher is talking about is to remember to praise the opposite. So if there's like a typical problematic behavior, to really be mindful on catching when they actually are engaging in the opposite, because they are, even though when we're reactive, we think, oh, they're always like this, they're never like that, and so on. So
Yeah.
that's a really important one. The other one that I think is important is to be able to sit through and tolerate the discomfort of setting a limit. Because I think setting limits are hard for many reasons.
Yeah.
And one of the reasons is not wanting to deal with the wave of emotions that your child will experience. And so if you set a limit, it's being clear, kind, and firm, and confident. And that means being like the steady presence, regardless of whatever reaction our child has. And the more we do that, then over time, our child learns that, oh, when my mother or my father, whoever my caretaker is, sets a limit, they're going to be steady. I'm not going to be able to whine or throw a tantrum or negotiate, and they're going to waver.
Yeah.
But I think also, though, when we approach that limit from this confidence, our children sense that. Like if we have this internal ambivalence around the limit and whether we're really going to, set it, our children sense that. Versus if we set it very confidently and clearly, they sense that as well.
So for an example, Dr. Kurahashi, if like one of the things I deal with on a daily basis is I just got my older one a little Game Boy that he plays with, and he'll be in the zone and I'll be like, okay, turn that off. It's time to get ready for bed. It's time to get dressed. And he's one more minute, constant negotiating. What is something in that moment? Because I'm sure this can be related in many different ways, not just a Game Boy. What is a way, like, what would you say to him? Word for word, what do I say when he doesn't listen?
Well, I think, we talk about the ABCs of behavior as well. And so we think about what is the antecedent, like what happens before, what's the actual behavior, what's the consequence. And so a lot of these situations, we want to think about what's leading up to it. So if you're going to give your child some screen time, which makes perfect sense, you want to be thinking about how do you set it up? Like, what's the agreement around how much time? How do you decide when that time is over? And then how do you talk about it? And then what happens afterwards? And so I would be clear around, okay, you get your Game Boy time at this time for however many minutes, maybe set a timer.
Yeah.
Is it helpful to have like a 1 minute, you know, warning
Yeah.
timer so that there's an adjustment? Because if they're saying, oh no, like I just need to finish this round, or I just need to enter whatever, all these things that are super important for
Yeah.
children. But then maybe then the timer needs to be a minute or 2 minutes sooner so that that's when they start doing all those things.
Okay. Yeah,
Um,
we're very familiar with timers around here, but I think what I need to do going forward is not just letting him pick it up, but say, okay, you're going to get 15 minutes on this
Exactly.
and set the intention beforehand. And I think that's where like that's where I can improve, and I'm sure others can too, because what I do is I'm like, okay,
Yeah.
that's it. Okay, we're going to set a time for one more minute, but I think setting the intention in the beginning is key. So thank you for that.
And I think
Okay.
the
Yeah.
other thing I would elaborate there too, Arielle, is that it's kind of like you're contracting with your kiddo before they're engaging with their screen,
Yeah.
and you're being really transparent about what the expectations are, and you're setting him up for more success, and you're setting yourself up for more success
Yeah.
in that moment. And then I think the only other thing that I'd add to that, especially if you're going to be starting to make a change like this, is letting your child know moving forward, every time that that timer goes off, I'm going to let you know that screen time is over, and I'm going to hold firm to that. And I'm going to take that Game Boy away, and we're going to go do whatever it is that we
Yes.
have to do next. So that you're also letting your child know exactly what to expect from you, and exuding that confidence that Mario was just talking about, and then also being really consistent and predictable in your
Yeah.
response.
And if they don't listen, essentially, because that happens, you say, okay, I'm sorry, I'm gonna have to do this. You're not gonna have your Game Boy tomorrow, and just be very calm and stick to it. And I think I have an issue, and I'm sure everybody else does too, with making threats and then not following through with them. We can get to that later, but that's definitely something I struggle with.
Mhm.
Okay.
yeah.
So I also want to talk about the power of special time or one-on-one time and why it's so impactful for improving behavior and reducing power struggles. So tell us more about that and how we can all integrate that into our parenting.
Yeah, so one-on-one time comes from there is a significant amount of science to back up the power of one-on-one time. So let's just start there. And what one-on-one time really means is exactly what it says. It's spending one-on-one time with your child in a connected way. And so a couple of key things that we always recommend when initiating one-on-one time is that one-on-one time needs to happen at a time where you as a parent can be fully free from distraction. This isn't a time where you're answering work emails or you're trying to cook dinner or the TV's on or whatever it may be. This is a time where you can be present with your child and you can engage in an activity that they enjoy, which I know can sometimes be hard because sometimes our kids enjoy things that are really boring for us as parents, or we don't enjoy them, and sometimes we're having to kind of like fake it a little bit but be
Yeah.
present and involved. And so especially for younger kiddos, this can be in the context of one-on-one playtime, right? So it could be playing with dolls or various toys or Legos or whatever your child may be into, and really following along with their lead, letting them create and guide the play. And then you describing what it is that you notice that they're doing, all the appropriate things that they're doing, all the things you want to really see more of, praising those things, reflecting back to them what they're sharing with you, and letting them be in the driver's seat. Because especially the younger our child, the they have less time in their day that they're ever really fully in the driver's seat, right? We're
Yeah.
much more kind of guiding them throughout their day. So this is this opportunity for them to be in control and guiding what it is that you're doing. Um, as kids get older, special time can take on different forms. So it's not going to necessarily be in that one-on-one play anymore, but maybe it's going on a walk around the block or walking the dog together, or having your child share with you their favorite comic book or something that they're really into that they're reading or playing or doing, engaging in a board game, different things that, or cooking together, different things that your child enjoys and that you can connect one-on-one with, but that you're also not distracted by these other kind of the other stressors or demands of our daily life. The key thing with one-on-one time is that it doesn't have to be more than 5 minutes
Oh,
for it to be effective. And
okay.
so I think that one of the biggest things that I talk a lot about with parents is they say, I just don't have time for it. And I
Right.
know we're all, we have so many demands on us throughout a given day. But if you can carve out 5 minutes of time where you are fully present with your child and connect with them on a topic or a type of play or whatever it may be, that that can be enough to build that strength and to kind of really strengthen that bond with your child and build that opportunity for connectedness and strengthen that foundation for your relationship so that when there are those hard moments and you've got to set those limits, you have a much stronger foundation to lean back on.
I love
Um,
that. I really do. I have two kids, and I think a lot of us on this call have more than one, but even for those who don't, if you do have two kids, and I have one that's 4 and one that's 7, they like different things and one-on-one time. Sometimes I am alone with them and I want to have one-on-one time. Do you recommend like being like, okay, I'm gonna have one-on-one time with you for 10 minutes and then you for 10 minutes or whatever it is, and they have to entertain themselves for those other 10 minutes and to have that special time if another adult isn't present. Is that some like a good way to do that?
Yeah, it's a great strategy. And I think again, like 5 minutes is great because
Okay.
it sounds doable, but then in the moment, it can, because then that's 20 minutes total.
Yeah.
And then there's a less chance of then actually doing it in a consistent way, especially when
Yes.
you're on your own. So, really, just 5 minutes is
Okay.
what the research says is
Amazing. That's
sufficient.
awesome.
And so, just doing 5 and 5. There's a evidence-based treatment that Elizabeth and I both do called PCAT, or parent-child interaction therapy, and that's the foundation of the treatment. And I believe strongly in not just talking the talk, but walking the walk. So, like with my own kids when they were 7 and younger, I would really stick to it, and it's hard. It's hard to do it as busy as life can be, even 5 minutes.
Yeah.
It's just seeing how much your children love it. And then when it becomes part of their routine, they ask for it. Like
Yeah.
they're like, oh, it's special time. And then I think also, though, what's really important is not only is it helpful for children, it's really helpful for parents. Because as parents, we have spent so much time, especially these days, thinking about parenting and, wanting to teach our children, mentor our children, coach our children, and all these things. But during special time, because like Dr. Ashir is saying, we're not in the driver's seat, so we're not asking questions, we're not giving them directions. It's really an opportunity for us to just sit back and enjoy our child without having to worry about directing them or teaching them anything. And that's also really helpful for parents, um, to be able to be fully present and just enjoy their child fully.
And if do you ever like, I don't like to, I hate using the word threaten, but like, would you say that special time is a reward? Or is that just something? It's just part like, can you
well,
say like, you're not going to have special time with me if you do continue that behavior? I don't like, is that something that you could say? Or do you
I'm
not
so
really like
glad. I love that you're asking that question because it's a really common one. And I'd say no, you don't want to threaten taking away special time.
that? Okay.
Special time is something that becomes part of your daily routine and that your child can come to rely on. That no matter what's going on that day,
Okay.
you have that opportunity for special time. And I see it as in the work I do with many families and in my own family, it can be an opportunity for a reset. too. So especially if you're having a really hard day, or
Yeah.
your kiddo is just, yeah, giving you a really hard time throughout the day, this can be an opportunity to reset and kind of redirect the way the day is going. So I would not, this is
Okay.
not something to take away. This is something
Okay.
that's always there.
That is helpful. Okay. The next question. What's the best language to use when you are setting boundaries?
It certainly depends on many factors, but one guidance that we give is in giving effective directions. So a lot of times as parents, we speak to our children the way we do to our colleagues, our friends, our partners. And so we want to oftentimes soften our language. So we'll say, oh, can you go brush your teeth? Or let's clean up. But for children, we want to be really clear and be fair because it's not actually a question. You're actually giving them a direction, which you don't typically do with a friend, let's say. And
Right.
so you want to make sure that you're really clear and you say you can be polite. You can say, please go brush your teeth. Please, clean up the Legos or whatnot. So being really clear. We also want to make sure that the direction is not too vague or too broad. And so we want to break down rather than saying like clean up your room, which might be a lot for, especially like your children's age to do. And so you might break it down into smaller steps. And then what's also important about that is that after compliance with each direction, you want to be giving praises, specific praises for listening right away to your direction. So, okay, it's time to clean up. You're going to set it up. You're going to clean up your room. Please start with, putting the blocks away. Great job listening. Oh, you're so good at cleaning up. Oh, wow, you're putting all the blocks. So you're reinforcing that. And so you're setting it up where you give a clear direction and you're also using positive reinforcement and
Yeah.
praising their follow through.
Well, then I'm doing it right because yesterday I said to my son when he did, I said, he jumped up when I told him to do something, which of course shocked me. I almost fell over. And I said, good listening ears, and I was really, trying to give him some positive reinforcement. And then he started wanting to listen more because he liked that positive reinforcement. And for me, I always say, like, if you continue to do that, maybe there'll be a treat at the end. I like to reward them with, and I don't know if that's okay, but I do that a lot.
Well, so that's great that you knew, instinctively to really praise his listening right away. And the great thing with children is a lot of times that verbal praise is sufficient. And especially if you're seeing it working, then you can just leave it there.
Okay.
And I, typically recommend saving like the more material bribes for things that are harder, more challenging.
Yeah.
If you're seeing progress just with the verbal recognition, your emotional, recognition, I think it's fine to leave it there. I
So
was
you're
just working
saying
with,
I go too far sometimes. I can just let it go.
as we
Okay.
all do, as we all do, yeah.
Yeah.
Yeah. Okay.
But I was working with the family just this morning, and we're working on giving very effective directions, and they were reflecting on how just that shift over the past
Mhm.
week, they've seen tremendous improvement in the child following directions. That alone, that simple, rather than saying, can you or let's or giving too vague of a direction.
Okay.
And just that small tweak has been
And the
really
tweak is
noticeable for
saying,
the family.
instead of saying, can you please go brush your teeth? It's, I need you to go brush your teeth. Is that a good
Or
way?
just really like as concise as so please go brush your teeth.
Okay.
Yeah.
That's helpful.
So replacing the can you with please.
Well, the good,
Please
I,
do this.
I kind of
Please do
learned that
that.
on my own because when I say, can you, the answer is always no. So
Yeah. Right.
I
Yeah. Well,
think
you're
that's,
phrasing it as a question. You're
yeah.
acting like there's an option when there's really not.
Yes, I like that. Okay, next question. What's one simple approach that parents can use when they feel triggered or about to lose it themselves? So for me, I like, especially during that time of the month when I'm really irritable, I get really triggered and I'm like, do it now, and I freak out and I'm like, nah. And I have to like take a minute and like be like, okay, stop,
Mhm.
like take a deep breath. And I'm sure that's breathing is probably a part of your recommendation, but tell us what is something what's an approach that we as parents can take to, counteract that reaction.
Well, I think that's great that, like, just in that example that you just gave, you're noticing in those moments of like, oh, wait a minute, I've got to I've got to take a beat here and take a
Yeah.
breath and re-regulate myself. And I think that's it's such a powerful piece of the puzzle, right? That if we want our kids to be more regulated, we have to show up in a more regulated way, right? If we're losing it, they're likely losing
Yeah.
it. Or if they're losing it and then we start losing it, now we're all losing it. And it's just not helpful. And it happens, right? And we've all been there,
Yeah.
right? So there's like it happens to all of us. But one thing that I really love to do myself, and I also talk with parents a lot about it, is just so breathing is one of the things. Just take 3 really deep breaths, right? Just pause for a moment and really notice the breath coming in through your nose, filling your chest and stomach with air, and then breathing out. And even just 3 regulating breaths like that, 3 deep breaths can be really powerful in just calming the nervous system down. Some parents will say to me, I hate breathing. Don't tell me to breathe. Like everyone just tells me to breathe in these moments. It doesn't work for me. So I think part of it is also finding what works for you. Sometimes for me, I'm going to go take a bathroom break and I'm just going to go take a minute in the bathroom to close the door and just turn off the lights and just be without stimulation for a moment.
Yeah.
Right. Or it doesn't have to be the bathroom, right? It can be any place in your
Yeah.
house, like where you can just kind of like take a moment and then come back out in a more refreshed, regulated way. The other tool I also like to teach parents a lot is just being more mindful in the moment. So noticing, what am I smelling right now? What am I feeling right now? What am I seeing right now? What am I hearing right now? And it's really just evoking all your 5 senses to really reground yourself in that moment, and then be able to turn and be more present for your child. Um, so there are a lot of different ways that we can do it, but I think part of it is like, key is, one, being aware that this is happening and it's something you want to change or kind of try to get a little bit more of a handle on. And then two, figuring out what is the strategy that does help you in that moment most. And it may be different depending on where you are or what you're doing or what time of day it is.
Yeah.
And then also, I think the third piece is noticing if there are certain times of the month or certain
Yeah.
times of the day or the week that might be particularly stressful for you. I always like to think of, like, if I have something big coming up at work, I know that maybe the day before that or a couple of days before that I might feel more stressed or more irritable, right? So noticing what are the things that are coming up for you that may lead you to be more vulnerable to your emotions.
That's really helpful. One of, something that does happen, and this is off the cusp, a question that I have. Rushing. I think rushing is something that all of us do all the time. We're rushing our kids out the door. We're rushing our kids to go eat, get dressed, do their teeth, brush their teeth. How detrimental is rushing our kids? And what can we do in the moment when we are rushing? Is it like, okay, take a beat for 30, like let them have 30 seconds and it doesn't have to be done in 1 second? I mean, tell us what's like something that we could do to, because when I'm really irritable, I notice I do a lot of rushing.
Yeah. Well, so, rushing, it's part of the reality of our current lives. And so we're not going to be able to protect our children from rushing necessarily. And at the same time, I think it's a great point because I think when we're rushing, it's also an opportunity for us to self-reflect on our contribution to that situation because, maybe we're up a little too late, kind of scrolling on our phones. Like, could we have woken up 15, 20 minutes earlier? And then I would be more on top of things. And then the rest of the morning would be less rushed. And just being, just honest with ourselves about what has led to this rushing moment and what can I shift going forward so we're not always in this cascade of
Yes.
rushing.
Yes.
And then also, once we're in it, which is normal, we're not perfect. But once we're in it, also being honest about our potential role in the situation and not just kind of taking it all out on our kids. Because when we're in the heat of the moment, it's very typical for parents to kind of be extra irritable and
Yeah.
extra impatient when we might have had a role in the situation as well. Um, and so just to kind of keep that in mind and kind of this not kind of going into blaming the
Yeah.
child mode and going back to what Dr. Rasher is saying in terms of, being present, being grounded, and not letting kind of our reactive mode kick in. And I think it's related to the previous question because it also requires a commitment, I think,
Mm.
to um, not be whatever it is, like not yell, not use like,
Yeah.
certain language or whatever it is, like to really commit to that is so that when you notice yourself heading in that direction, you're also committed to doing whatever it is, whether it's, I'm going to take 3 breaths no matter what. I'm going to, take a drink of water. I'm going to, and just, because part of what that does is, there's like a biological reflex of a stress, response, fight, flight reaction that happens when we're stressed. The adrenaline is going. And so that's what leads to kind of that dysregulation. And so those grounding techniques that Dr. Rasher described help break that cycle and kind of helps us be able to access our own impulse control, our own regulation better. And at the same time, again, everyone's human, so it's not like you're going to 100% do that. But the commitment or the intention is really being clear about how that's what you're really moving towards. And then if you, don't do it, it's acknowledging that and then recommitting and kind of coming back to that intention.
That's such a great reminder because I know that when I was getting my kids ready for school and we had a new start time, we temporarily have been relocated and school starts earlier. And I noticed that my days were so rushed in the beginning and I was freaking out. I was like, get out the door. And then I was like, okay, I can get up a little earlier. And I didn't want to, but I did. And I started setting my alarm. And now I just have an internal alarm clock that wakes me up every day, or my dog at 5 in the morning with a toy in my face. Um, but either way, I noticed that when I started waking up earlier, the whole morning went smoother because I was allowing the kids to have a little bit of me time before their day was kind of like so structured at school. So I think that's such good advice. My only question, I guess, from that is like, when we are rushing them, are we giving them anxiety? Like, are we giving them an anxiety disorder?
That was a thing on social media. I saw,
Yeah.
I
Yeah.
forget what they called it. And no,
No.
like I don't think
Okay.
that itself causes this
Okay.
trauma or an anxiety disorder. I mean, again, it's, there's only so much we can do to protect our children from the realities of life, and being able to handle being rushed is, I think, a normal part of life.
Right.
So I don't want that to add stress to parents. Like, am
Yeah.
I harming my child by
Yeah.
rushing them? No, I
Yeah.
don't think so.
Okay.
It's just qualitatively for everyone. Can life be more qualitatively improved
Yes.
if we kind of reflect on what's contributing to the rushing? How
Okay.
can we modify things like just like you did?
Yeah.
And how can we practice this self-regulation when we are also stressed and
Great.
modeling that for our
Yeah.
children?
Super helpful. And I'm so glad to know I'm not causing my son a
No.
anxiety disorder. Okay. Next question. So the next kind of subject matter we want to talk about is emotional regulation, ADHD, and mental health, because that was a big theme in a lot of the questions we got. So big emotions, ADHD, anxiety, and even OCD were coming up for many families. So what are some practical science-backed ways to support these challenges? And without going into too much detail, because not everybody is dealing with this, but can you provide some insight there?
Yeah, I mean, it's I think a lot of what we're talking about so far are some of the foundational tools for any of these concerns, right? And so when we're parenting in a way that's consistent with our values as a parent, and also in a way that's helping to kind of lay that strong foundation for a secure attachment with our child, and helping to kind of set set them up for healthy social emotional development, that's part of our goal, right? And so a lot of the strategies we've discussed, I think, help can help to reduce risk for anxiety, ADHD, other disruptive behaviors, OCD, and at the same time, when your child has been diagnosed with one of these concerns, there are specific strategies that can be very targeted for each of those different disorders. I think it's hard to speak specifically to each one
Yeah,
because there's so much uniqueness within the child and your family system that is going to guide that process. But I think when we're thinking about things that kind of fall into that category of more challenging behaviors, and whether or not that's fueled by a child's ADHD diagnosis or not, some kids with ADHD, a lot of how that can present is really challenging behavior, right? Or kind of difficulty, kind of following through with their tasks or remembering what they have to do or staying focused, doing their homework, all of those sorts of things. So being clear and consistent and predictable in the way that we're setting our expectations for our kiddos, everything that we've kind of talked about already can be really powerful in helping, again, to set the stage for success, for more success for our kids. And then the other piece, of course, of noticing when our child is actually engaging in the more positive behavior, the things that we want to see them doing more of. We miss those. I mean, I do it all the time. I miss these like beautiful opportunities to be bringing really nice attention to these moments because our minds are more primed to focus on the negative behaviors, right? So we're going to be more likely to kind of bring our attention and energy to the time when our child isn't paying attention to their homework rather than when they are sitting quietly at the table doing their homework, right? So
right.
actually bringing our attention to that moment when they're sitting quietly at the table doing their homework is going to be way more powerful than correcting them and trying to get them back to their seat, when they're getting more distracted.
Sure.
So there are definitely specific. I mean, I think my biggest guidance is if your child, of course, has a diagnosis that falls into one of those categories, making sure that you're working with someone who's
Yeah.
qualified to help guide you through that process. And I think making sure that as a parent, you're involved in that process, especially kind of if you have someone who's 12 and younger, right? You're going to be much more involved in that process than necessarily for our teens.
Yeah. What's
Um,
so that we have so much more to cover, and I don't want to spend too much time on this, but the last question I have, I guess, about ADHD. What are some early signs? Because and how early can you diagnose ADHD, where you would need to seek professional help? I guess is like what are some things to look out for?
Great question. Because ADHD is, there's so much more awareness about ADHD now, which is fantastic. And at the same time, with more awareness, sometimes there can also be overdiagnosis of ADHD or over pathologizing of, just childhood behaviors, especially young children. And so, wanting to be balanced there. I think if early, like for younger children, like 5 and under, if there are concerns about there's a lot of activity, there's a lot of impulse challenges, more so than what you're seeing among their child's peers, then there are interventions that are evidence-based that could be really helpful. It's a lot of parenting and dyadic work, including what I mentioned, PCAT or parent-child interaction therapy. For children who are more in the elementary school years, what you'll be looking for is there impairments in the child's functioning? Is this teacher also noticing relative to classmates? There's a lot more challenges than what would be typically expected.
Okay.
Uh, and then certainly an assessment is warranted. And also the wanting to be careful and rule out, is there any possible learning challenge that is, either comorbid or explains some of the attention challenges or the acting out in class or lack of focus. Um, Or is there anything else, anxiety or whatnot that could be part of the picture or could explain some of those symptoms, but doing a thorough assessment when there is, again, impairment in two environments. Usually that means school and at home.
Yeah, no, that's really helpful. Thank you. You know, I have a child who he just can't sit still, for example. Like he when we're reading together at the table, he's standing up and moving his body constantly. I'm like, I just wonder. I'm like, is that a sign? I don't know.
How old is your child?
7.
7. Yeah. And is the teacher also noticing
No,
that kind
the
of?
teachers haven't said anything about it. But that's really the only thing that he does that I wonder about
Mhm.
is the not sitting still. He's just he needs to be moving like a lot.
Yeah.
Yeah, I don't
I
know.
think I think I think what can be really challenging with ADHD is that there are so many kind of components of ADHD that um that when we look at what is typical for a child's development over time, there we can see some kids being kind of more impulsive earlier on, and that impulsivity decreases over time. We can see kids having trouble sitting still, and that decreases over time. We can see kids being more forgetful, or if you kind of look at the criteria for ADHD, all the different things at different points in a child's life are kind of almost like within a developmentally kind of appropriate
Okay,
at different points in their life. It can be very developmentally appropriate
got
to
it.
have a harder time sitting still or whatnot.
Okay.
And so I think, as Dr. Kurahashi is saying, as your child continues to develop over time, really focusing on that impairment piece of things. Is this getting in the way? Right? Is this,
That's
and I'd
helpful.
say that for many of these different concerns that come up, right? Like, is it starting to present challenges where now we're not able to enjoy a meal together as a family, or my
Mhm.
child's not able to do the work that they need to be doing, or it's getting in the way of them, of friends wanting to hang out with them, different things to look out for, and
Yeah,
kind of consulting with your pediatrician, consulting with a mental health professional can
that's
be a
very
great place to
helpful.
start.
Thank you. Okay. Now I want to talk about sibling conflict, routines, and adapting to each child. That was a big thing. I have a few questions in there, but because we're running a long time, I'm going to be just kind of summing up some questions that I think are the most important for everybody to hear. So, how can parents handle sibling fighting, especially when it turns rude or mean or persistent?
Yeah, it's a great question. I think my rule of thumb when it comes to sibling conflict is how important it is for parents to really be fair mediators. A lot of times with the younger child will kind of get away with more things than the older child, for example, or if there's one child who's more kind of challenging, they might be more blamed easily. And so what's so important is to take each situation as is without kind of history and just really look at it objectively and to remember that usually, it takes two, right? So usually maybe one instigated, but there was a reaction that then led to a bigger conflict.
Yeah.
And so really highlighting the role of both and really addressing both child's role and what led to the escalation so that each child feels heard.
Yes.
Um, and because typically what happens is, it's really annoying, it's really frustrating. And so you kind of yell at the older one or the more like impulsive one or whatever it is, and you just carry on. But what happens then is that it can really lead to a sense of injustice and lead to more resentment that then keeps being acted out over and over again. And then it can create these narratives of each child that's not fair either.
Yeah.
And so that's what I recommend a lot when I talk about sibling conflict with families. And when we unpack it in session, it's really helpful, I think, for parents to see, oh, that's right, the other one definitely had a role in this and
Yeah.
totally got away with it, And so And so I think so one, it helps, um, you know, decrease that resentment. It helps fairness, validation, each child feeling heard. And it's also modeling for your child how to view relationships, how to view, fairness. And then when we're also being fair and looking at it more calmly, we're also modeling, you know, better communication skills as well, rather than just kind of blaming or judging.
Yeah, I will share a personal thing. I mean, we blame our older one a lot more than the younger one because it's typically the case. But what started happening is my older one started saying, I hate my brother. I hate my brother. And it was because he was getting blamed for everything. And so that
Mhm.
really set it off in me where I was like, okay, we can't keep doing this. And so I started doing what you just said was like, Max, you shouldn't have done that either, and I'm trying to equal the playing field out a bit. And I noticed a big shift after I started doing that. So I can attest to that does work. It really does. Okay. The next question. So this revolves around confidence, resilience, and long-term tools. So many parents want to raise confident and expressive kids, but it's really hard to balance that with structure. So if we value the idea of self-expression, how can we give our kids a voice in daily decisions, like what to do after school while still providing guidance and structure? Like, can you share some examples of how to offer a choice without creating chaos?
Good question. I love the idea of choices, exactly what you just said. So this idea of you as the parent really curating what the options are and then giving your child the opportunity to choose from those. And that definitely, the younger the child, that works better. As our kids get older, they having them involved in what those choices may be can be really helpful. So being more collaborative in that process. But I think no matter what age or child, involving them in that decision making helps them learn how to have a voice, how to build that confidence, but then we're also guiding. So when you're offering these choices, you can kind of think about them as you're almost kind of putting guardrails on the situation, right? You're creating some guardrails in terms of what are the options that are going to be kind of more or less acceptable, and then how are you now thinking through as a family what we're gonna choose. And this can be, I mean, I talk about this with families all the time around screen time, right? Or when families are kind of making that choice of, do I give my child a phone or not? Of really sitting down and thinking and having a collaborative discussion around, well, how are we going to handle this, right? When are the times that are, being very proactive of when are the times that you're gonna have access to your phone? What's gonna happen if you use your phone more than you're allowed to? What's gonna happen if this happens, and kind of thinking through that with your child and then deciding on what the plan is going to be. So you're kind of putting those guardrails in place, you're providing guidance, but giving them a voice.
That's really helpful. So, like, for example, if my kid comes home from school, he wants to watch TV, but you're setting up like a timer, for example, that's the way you can do it with like a structured way, but you're giving them a choice. Do you want to watch TV? Do you want to do your homework first and then watch TV?
Right.
Something like that.
Ex- Exactly. Like, we have these four things we've got to do in the next couple of hours.
What
Here,
order
here
do
are
you
the
want to do
things.
them
What
in?
order do you want to do them in? Right?
Love
Like,
that.
you're not giving a choice about which ones they're going to do. You're just
Okay.
giving a choice about what the order is or which one they do first, as long as that's like okay to you, right?
Yeah,
So you have to think about what's going to work well for your day or the situation. You're still the parent, right? You're still the caregiver. That's in control of what those choices are, but your child can then have a little bit of say over when it happens.
that's really helpful. Okay, I'm going to do two more questions before we do like a quick lightning round of fire questions that are just going to be quick, quick, quick. So this is just a question that was one somebody from the audience had asked. What helps children become more comfortable with taking risks and trying new things and making mistakes? So like maybe swimming or jumping into the pool or trying a new food or whatever it is.
Great question. And I think it's a balance. You want to recognize and celebrate who your child is. And that can be hard if your child is different from you or what your hopes and dreams were. You know, if you're a big athlete or a big risk taker and your child is not, it's an adjustment. And so and that's okay. It's okay for that to be painful, a little bit of grieving of what you thought your parenting experience would be like. And at the same time, you know, really celebrating your child's uniqueness and making sure they feel loved and accepted for who they are. And at the same time, part of our everyone's growth is to grow, you know, grow beyond our comfort zone. And so they may not become, you know, a roller coaster junkie if they're very scared of heights. And at the same time, it's really encouraging and praising even small movements towards flexing. You know, if they are very particular about food, we don't want to label them as, oh, that's the picky eater and create and like limit them with this narrative. And anytime you see them being a little, even a tiny bit open, you know, really acknowledging that and praising that, and leaving room for their narrative to grow beyond however they are at 3 or 4 or 5. And then sometimes, especially as they get older, I think it's helpful to give them experiences that allow them to grow, that pushes them a bit, but it's balanced. We don't want to overflood them with fear, but we also don't want to avoid things because they might be more cautious. And so it's kind of that sweet spot of always keeping that in mind. Like we want to be pushing our children in a supportive way while not overdoing it or shaming them either.
That's a really great answer. Thank you. Okay. Gentle parenting is a huge trend with influencers right now, but it's not all grounded in evidence. What advice do you have for parents trying to make sense of it all?
Oh, it isn't all grounded in evidence. And I think, the thing that we really focus on in the work that we do is balance, right? And it's balance around that connection and love and support and warmth. And so using our valid tools of validation and empathy and really being able to hear our child and give our child space to express their feelings and needs and wants and desires while also being clear and firm in what the expectations are, what the limits are, what the rules are, and that they don't get to make all the rules, and that we are also in charge of the situation. And what we know is that children are actually, they look to us as their parents and caregivers to be in control a bit and to be in charge. And when we don't provide any limits or any rules, it can be quite destabilizing for our kids and can actually increase risk for anxiety and stress. So I guess the best way to kind of the best takeaway is really thinking balance. Can I show up in a balanced way for my child where I'm really holding these two pieces of warmth and care and limit setting, or warmth and care and support and love, with being able to set limits and being able to have rules and following through on what the expectations are, and trying to strike that balance, which is sometimes always easier said than done, but that's the big guidance around that.
Thank you. Okay, I'm going to do 2 questions. It's a lightning round because we don't have time for more, but there are ones that I think that are profound. I think they're good. They're good questions. And then I'm going to announce the winner of the giveaway for Mama Soul. So for Mama Soul, whoever still stayed on the call. So thank you for hanging around. We have 3 products: Face, which is right here, 100% mineral moisturizing sunscreen, SPF 30. We have our Body Brella, and then we have our 100% mineral tinted lip oils, SPF 20. They just won New Beauty's Best Lip Gloss with SPF award. So that's really exciting. So you'll get to pick one of the products from our line, and then you're also going to get a 30-minute consultation with Dr. Reichert. Am I saying that right? I know I said it wrong at the beginning.
No, that's okay. It's Reichert.
Reichert. Okay, with
Yeah.
Dr. Reichert. You're going to get a 30-minute consultation, which I think that's like invaluable. I would love a consultation with you. So I'm going to announce that at the end. Okay, so the last two lightning round questions are, how do we handle parent preference when a child only wants one parent? I've experienced this. I can share my own insights, but I want to hear it from you.
Great question. And that's where I think appreciating child development is really important. And it's very normal for children when they're younger to prefer mom. That's just for whatever reason.
Yeah.
But sometimes it's dad,
Yeah.
it's not always mom. And so just knowing that that's normal,
Mhm.
and celebrating, I think, the moments when they are with the other parent is really taking that as an opportunity to appreciate that time, soak it in, and know that it shifts. It shifts as the child grows. I know I have a son and a daughter, and until maybe my son is now 10, then maybe until last year, he was always all about me. And now it's really interesting to observe his shift to dad. And it's like bittersweet. It's
Yeah.
kind of like, oh, and at the same time, I recognize like it's healthy for him. And there's a lot of reasons for him to be, moving towards his father. And so I think trying not to take it personally. And also though, again, like we see balance too much. And it also comes to balance again, where it's developmentally normal. And like, are there things I can't be doing maybe differently that is impacting the relationship, the trust, the closeness, and are there things that I can modify to keep strengthening that relationship if I'm not the parent of choice, while also, again, not taking it too personally and appreciating the developmental process.
Yeah, no,
Like special time.
and I can attest to, sometimes it's dad. Both my kids wanted their dad early on, and then it switched to me. And now my 4-year-old only wants me more. But it really hurt me in the beginning. It was really, really hard, but it changes. It
Mhm.
changes quickly.
Yes.
And I'm glad I saw that with my first one, because then I didn't get upset with the second one. Okay, last question, and then we're gonna announce the winner. Um, okay, here it is. How do I support my child emotionally while going through something hard myself, like a health diagnosis or a personal struggle? We have someone here, and I don't know if they're on the call, but they are going through a cancer journey, and they want to know how to handle, parenting while going through something like that.
Well, first off, I'm very sorry to hear that, and I appreciate the question because I think, at different times, at different stages in our lives, we kind of can run into these very challenging situations that we're having to manage. And I think the biggest thing that comes to mind first around that is making sure that you are doing what you need to do to take care of yourself. And so whether that is from a medical standpoint and following the medical guidelines that you need to follow, but I think also very importantly making sure to cultivate a support network for yourself that helps you feel like you're getting the support that you need. You know, I use this kind of example often, but I find it very helpful of, even just when you're, on an airplane and they're going through the safety protocols, and they always say you have to put your oxygen mask on first before helping others. And this question makes me think about that, in the sense that we have to be doing what we need to take care of ourselves to be able to show up in the way that we want to as a parent. And so I think that can apply for so many different things that we go through as parents. But really taking a moment to check in with yourself and say, what am I missing right now? What do I need that could help me feel more satisfied, feel healthier, get better sleep, whatever it
Yeah.
is that you're missing, to try to make that shift and attend to that need so that you can show up better
Yeah.
in your parenting. And it's
Yeah.
not about neglecting ourselves as a parent to be the best parent. It's actually taking care of ourselves and modeling the importance of taking care of ourselves for
Yeah.
our kids,
That's
to
exactly
then be able to
why.
take care of them.
Yeah, that's exactly why we started Mama Soul. It was all about taking care of yourself first, We use the same analogy as putting that oxygen mask on first and just reminding you, like, sunscreen is not getting a massage, but it's a reminder to take care of yourself, so that maybe you do go get that massage. It smells so good. You take a deep breath. So with that being said, I want to announce our winners. So, Sophie, you're going to win a consultation with Dr. Reichert. And Shayna, you're going to win. And make sure you're following Shop Mama Soul and the parenting Stanford Parenting Center to win. Shayna, you're going to win anything you want from the Mama Soul line. You get to pick one product. So we're going to email everyone that attended, and then you'll just reply to the email with your, and we'll put you in touch with everybody. I want to wrap up by just saying thank you so much for your time and your wisdom and your compassion today. And thank you to everyone who submitted a question. Even if we didn't get to yours directly, please know that it really did help shape this conversation. I had a whole list of questions prepared before. And then once we got so many questions, I tailored it so that everybody received as much value as possible. And please note, like I said, I'm going to be sending a recap to everybody. You can a link to rewatch this episode if you missed anything, or if you want to share it with a friend. The promo codes will be in there as well. And if you wish to continue working with the Stanford Parenting Center, all the info will be there. So thank you guys so much. Thank you for going 8 minutes over. I tried to keep it to an hour, but I didn't even get to ask all of our questions. So again, thank you so much. You guys are awesome.
So much for
Thank
having
you.
us. Great to be
Yeah,
here.
it's great being here. Thank you.
Bye, guys.
Bye.